Hi, I am not Dr. Greg Wintereg, but you will be seeing Greg in just a couple of seconds. The reason you're seeing me, Jeff Bloomberg, the Chief Operating Officer at MGE, is I wanted to introduce this week's tip because it's actually pretty special. It's actually a preview from our upcoming online training platform, and specifically this is lesson 1 from a course Greg does called How to Get Your Patients to Want What They Need. So without further ado, I bring you Greg, and I'll talk a little bit more about the online training platform at the end of this video. Thanks. Hope you enjoy.
Welcome. I'm Dr. Greg Wintereg. I'm a dentist and a partner at MGE Management Experts, a dental practice management training company. And in today's lesson, I want to talk about the case presentation. But let's call it for what it is. We're going to sell the patient. That's why we're having them come back. And I want to take a look at the dental box. So let's picture right here around me plywood about chest high. I have very little room to move. And imagine that the plywood represents rules of engagement, so to speak, of selling the patient dentistry. So the first false idea inside the dental box is that you don't sell patients dentistry. Well, the actual truth of it is, if nobody sells anything in America, then no production, no commerce happens. So we can use a fancy term of case presentation, report of findings. We can dodge around and call it whatever we want to call it. We're having the patient back to sell them the dentistry. And don't think that just because you give it another name and a fancy term, they don't know it. So you can call it whatever you're comfortable with, but inside the dental box, you're not supposed to sell. Now, inside the business box over here, we know that the business owner has to be able to sell the dentistry, or there has to be some salesperson in the company that can sell the product or service. So it's just common knowledge in business that somebody has to sell. And quite honestly, if the owner can't sell the product or service in business, that business is not going to do well. It's probably not going to endure. It's probably not going to survive. So in the dental box, what's another false datum? Doctors don't sell. Doctors don't talk money. That's unprofessional. Doctor, that's beneath you. You shouldn't be talking money with the patient. They would much rather have the financial discussion with your appointment secretary or with your financial secretary. So you go ahead and you go talk about the dentistry and you show them the photographs and you tell them why they need it. And as soon as they say how much, that's your cue to call in your financial secretary. My financial secretary was Sandy. And I had heard from every dental guru, 6 different consultants and management companies, I'm not supposed to sell. So what is our job in dentistry inside the dental box? Our job is to look cool. We've got our white lab coat, our name is embroidered on the pocket, we've got our high tech, we're all digital now, we've got a laser, we got a CAD cam. Over in the corner, that's a saltwater fish tank, right? And so our job is to portray this image of professionalism and we're going to be the patient's friend. Okay, that's fine. But then over here, doctor, if we're taking a look at this from a business standpoint, you got to be able to sell. And what is selling? Selling is telling the person how much it's going to cost and working them through their objections, working them through their stops and barriers. So I have some really bad news for you, doctor. The day you signed your lease, the day you signed the loan, you were in business. And I have to beg you to quit operating on the false data, the false ideas in the dental box that you are not supposed to sell. I'm here to tell you, you have to sell. You must sell. And if you're going to flourish and prosper in the future, you're going to have to learn how to look at the patient and very comfortably say, that will be $3,000. That will be $5,000. That will be $10,000, whatever it might be. You're going to have to learn how to do that. Now, that might make you throw up just a little bit in your mouth. It might make you nervous. But come on, doc. You've done things a lot scarier than looking at the patient and telling them how much their dentistry is going to cost. You put needles in people's mouths. You inject the most sensitive tissue in the body with a needle. That's a lot scarier than looking at the patient and say that'll be $3,000. You take a 400,000 RPM burr within fractions of millimeters of soft tissue that it would destroy before you could lift your foot off the rheostat. That's a lot scarier than looking at the patient and say, we need to talk about the money. So I am encouraging you to give yourself a break. You can learn how to do this. And the purpose of this series is to teach you how to sell dentistry. I actually call sell the 4-letter S word, like inside the dental box. The term sell is the 4-letter S word. Some folks actually consider sell a bigger 4-letter S word than the real 4-letter S word that I can't say on film. But come on, let's stand back and take a look at this. You have a business. You have to help people. And the truth of it is, if you can't sell them, you can't help them. Now, selling has nothing to do with trickery, deception, overdiagnosing, overcharging. That is all 100% unethical. I am talking about learning a way where you are selling the patient what they need and actually how to get into communication with that patient so they actually want what they need. And in our profession, it's become too commonplace, and I have experienced this myself before learning how to sell properly, that the patient needs 6 crowns, the insurance pays for 2, so we do 2 now, 2 next year, and 2 the year after. And we're really excited if it's November and December, because we can do 2 now, and then in just a couple of months we can get another 2 done. And that is just not what the patient needs. And I'm here to tell you, if you play the 2 now, 2 next year, and 2 the year after game long enough, you're going to get burned. I had it happen to me where I prepped these 2 early in the year, and during the summer, one of these broke. Now, I had recommended they all be done, but the patient comes in now and they're upset because obviously I did the wrong ones. Well, I could stand back now and look at it differently and say, well, they should be upset because I actually should have used better communication and gotten them to want to do the 6 crowns that they really needed. So that is the point, that is the purpose of what we're trying to teach here in this video series, to actually teach you, doctor, how to look at the patient and get them to want what they need.
All right, so did you like it? We're pretty excited. The online training platform should be coming out in the next couple of months, and of course we'll announce it on our YouTube channel as well as through our various advertising platforms. As it stands right now, we have about 170 lessons filmed, and we'll be adding new content month by month. There's a lot of information that we want to share, and it's a great way to accompany your MGE training, as well as a great way to train you and your staff on additional principles to expand your practice. Now, as always, if you like this tip or you'd like to see other tips like it that are on our channel, I urge you to click the subscribe button and you'll be informed as new tips come out. Otherwise, if you need any assistance of any kind, please contact us at mgeonline.com or call us at 800-640-1140. Thank you.